Hi, Nurse Linda here. Today, I'm going to be discussing with you and demonstrating for you how to check vital signs. We're going to talk about the 4 basic vital signs today. First, temperature. Second, pulse. Third, respirations. And fourth, blood pressure. So, we're going to have to do our beginning task. The first thing is hand hygiene. So let's wash those hands really good and then let's assemble our equipment. Once we've assembled our equipment, we are going to want to introduce ourselves to the patient, let them know what we're going to do. We want to make sure we provide them with privacy. If there are any guests in the room and they feel uncomfortable, we could ask the guests to leave. We can close the curtain. So we have to do all that first before we begin. The next step is we need to assemble our equipment. We'll be taking an oral temperature today. So I will show you the oral thermometer that I have that we're going to use. This is the thermometer, and in the back here we've got some probe covers. Always want to put on a fresh probe cover. Don't want to be spreading germs, so that's our thermometer. Next thing we're going to need to use is a stethoscope. Alright, we're going to be using the diaphragm side. Some people like to use the bell side when taking a blood pressure, but it's preferable to use this side. And of course we're going to need some alcohol wipes. Got to clean that stethoscope between patients, and of course the earpieces for ourselves. And let's move this up to the side so I can show you the blood pressure cuffs. Today I have 2 for you to see. One is a child size one. All blood pressure cuffs have a cloth outer. Inside is the inflatable bladder. This is a child cuff, and it shows you with an arrow right there. That's going to be going directly over the brachial artery. We have the real important part, the sphygmomanometer, right there. Can we see that? Alright. And of course the bulb and the valve that inflates and deflates the cuff. So that's the child size one. And the adult one, of course, just same thing, bigger in size. This one does not specify right or left arm, but just gives you the arrow as to where you put it over the brachial artery. Alright, so that's our equipment. That's what we're going to need today. And let's get started. Before you get started with the temperature, the pulse, the respiration, or the blood pressure, let's ask the patient if they are in pain. It's really important. We want to keep them as comfortable as possible, and this is also another assessment tool. Some may consider it part of the vital signs. Ask your patient if they're experiencing any pain, where the pain is, what makes it worse, what makes it better, and how do they rate it? On a scale of 0 to 10, 0 being I have no pain at all and I am happy, and 10 is it is the worst possible imaginable pain, worse than I've ever experienced before, and somewhere in between. Is it a sharp pain? Is it like a dull, constant pain? Is it a shooting pain where when they have a movement, all of a sudden it comes from somewhere and it goes somewhere else and then it's gone? Okay, so after assessing pain, let's start with a real simple one, and it gives us the opportunity to kind of do a visual exam of the patient, and it gives them the opportunity to relax before we take that blood pressure. So we're going to take their temperature. Today we're going to be taking an oral temperature, but you can take an axillary temperature, underarm, you can take a temporal temperature. There are certain thermometers that just scan the forehead over to the temple. You can take a tympanic or in-the-ear temperature. You can take a rectal temperature and then the oral temperature. Rectal is usually appropriate for infants. Okay, so now we're going to take an oral temperature. So the thermometer I have today looks like this one. In the back, it has a compartment of probe covers, and here we are in the front. So the first thing, let's just push this button and activate it. It'll always give you the last oral temperature that was taken. So to activate it, to get a new one, we just take the probe out and we're going to push it down and into one of the covers. We have to push it hard enough so this little blue thing pops out. So here we go, we push it hard enough. Make sure you don't put your finger or your thumb on top or it won't stick. And now you can see there is a probe cover on it. So you're going to put it in your patient's mouth. You're going to have them open their mouth, lift their tongue, and place it under the tongue. Then tell them to relax their tongue and close their lips together. So let's just watch me take mine. Okay, that beep indicates that it's done, and you can gently remove it. And with this one, you just press the button in the back, and the cover comes off. So you just kind of put that right in the garbage can. Let's see, 98.1. I guess I'm normal today. Shoot the cover off and put the probe back into the thermometer. So in case you forget to write it down, with this one, you can always press this button, and there you go. That's the last oral temperature that was taken, 98.1. Okay, so when we take a pulse, we're going to do a radial pulse. There's many places that we can feel a pulse. We can do a carotid, we can feel a femoral, but the easiest and the most appropriate, giving the patient the most privacy, is a radial pulse. A radial pulse will be taken in the wrist on the thumb side, and you're going to use your first two fingers, your index finger and your middle finger. You do not want to use your thumb. You might be feeling your own pulse rate in your thumb. So you take your first two fingers, and you're going to kind of run along from the bottom of the thumb down into the wrist. There's kind of going to be a little notch in there. And just kind of gently press, and you are going to feel the heart beating there. So you're going to want to take the pulse for 30 seconds. If you notice any irregularities, or if the patient has a known history of an irregular heartbeat, then you're going to take it for 1 minute. Otherwise, you're going to take the pulse for 30 seconds and then multiply by 2. Really good idea to take the respirations after you've taken the pulse without letting the patient know that you're taking their respiratory rate. A lot of times that rate will change if they know you're paying attention to their respirations. So you can still just keep your fingers on their wrist, and rather than paying attention to that heart rate, pay attention to the respiratory rate. Or you can bend the elbow and move the wrist towards the chest, and then you can start taking the respiratory rate. You're going to want to take respirations for 30 seconds and then multiply by 2 to get how many respirations in 1 minute. The last vital sign we're going to talk about is blood pressure. One of the first things you're going to need to do is find the brachial artery. We're going to take blood pressure in the arm. Brachial artery is in the arm. You're going to find the brachial artery, the inside of the patient's elbow, or the antecubital fossa, and on the side along the pinky finger, just a little bit above the elbow joint. Press with your two fingers like you're taking a pulse, and you'll gently feel. Once you feel that, then you're going to know 2 fingers above that spot. So my 2 fingers, the cuff's going to go above here. That's where I will put my blood pressure cuff, and where I felt it is where I'll put the diaphragm of my stethoscope. Now, you have to take some things into consideration when you take somebody's blood pressure. If they've had a mastectomy, if they have an AV shunt, if they've had blood clots, a history of blood clots, if they have a fistula, you're not going to want to take the blood pressure in that arm. So, say I had a mastectomy on the left side, you're going to want to avoid the left arm, and then you're going to want to use the right arm. Hello! Hi, Nicholas. It's Nurse DeVito, and I need to take your vital signs today. I already washed my hands, did my hand hygiene outside the room, but I need to take your temperature, your pulse, check your respirations, and your blood pressure. How are you feeling today? Are you in any pain? Anything bothering you today?
Nope.
Nothing? All right, that's great. Now, you don't have any guests here, so we're just in your room, so we have some privacy there. So I am going to need to touch your arm and your wrist, all right? So I have all my stuff. I'll put it on the side. We're going to start with temperature. I'll be taking your body temperature in your mouth, okay? So first I'm just going to have you open your mouth. I'm going to put this underneath your tongue. Can you open your mouth for me? Lift your tongue up, and then gently put your tongue on top and close your mouth, lips together. Perfect. Okay, it beeped. 97.3. All right, normal. So I'm just going to take the cover, put it in the garbage, put this away. Okay. Next thing I'm going to do, Nicholas, is I'm going to take your pulse and your respiration. So I'm going to just borrow one of your wrists for a few moments, okay? All right, my hands are a little cold. You can relax your arm down. I'm going to find your radial pulse on the thumb side of your wrist. Okay, just relax. Okay. Take this for about 30 seconds. Olympic athlete or something? Your heart rate was 52 and your respirations, or how many times you breathe in a minute, was 10. The last vital sign we're going to take is your blood pressure. First, I'm going to clean my stethoscope. You don't want any germs from anybody else on you, right? Just like I washed my hands before I came in here, gotta clean this too. Alright. So do you have any history of blood clots? Or any AV shunt? You don't have any IV lines that I can see? Any reason that anybody's ever told you that your blood pressure can't be taken in one arm or the other? Nope. Alright. Okay, if I take it in your right arm?
Yep.
All right. My blood pressure cuff here. Feeling for what's called your brachial artery. That's what I'm going to listen to when I take your blood pressure. For you, with a pretty low heart rate, pretty low respirations, I'm just going to pump my cuff up to 180 millimeters of mercury. Down here, you just relax. Make sure this is on properly. There you go, perfect. Okay, gently slip 2 fingers underneath so it's not too tight. It's not too loose. Okay. So it's going to get tight for a little bit, and then it's going to slowly get loose, okay? There we go. Gotta have it closed if it's going to get tight. Okay, it's as tight as we want to go. Okay, 116 over 76. So that's excellent. All right, Nicholas. Everything seems to be great. Okay. You need anything? Can I get you anything? You doing all right?
I'm fine.
Okay. You got your call light, your TV remote, you're comfortable. Everything's good, and like you said, you're not in pain. So if you need anything, just call. Okay? All right. And that's how we do the vital signs on a patient.